important because we're talking about a shift really in the way you look at the world and how you respond to it. So the point of the reflective activity is to really try to, how often do I ask you to think of something negative, but to think of a conflict so that you can kind of walk through this process and get a feel for the difference of what happens when you move out of your head and into your heart. So hopefully you brought up a recent conflict and you filled out the left side of that form. I'm going to pull up the form in just a moment. But it's basically where you didn't get what you wanted, which happens to all of us every day, right? And then you answer the questions on the left-hand side of the column. And then what we're going to do now together is once you've answered those questions on the left-hand side of the column, then you want to try to get out of your ego. So I'm going to make a blanket statement, which may or may not be true, but the odds are if you got into a conflict or a disagreement with someone where you didn't get your way, you were probably very stuck in your ego. So what you want to do is what we just talked about. Think of a person or a situation that brings you peace to help you open up your heart. Take several deep breaths. Remind yourself that there is no right or wrong, only different perspectives. And then, this is new, you want to try to feel empathy for the other person or group. That's very hard to do if you're upset, right? You cannot feel empathy for someone if you think they're attacking you or taking advantage of you or any of those things. But if you first do the first three steps, open your heart a little bit, take a few deep breaths, and remind yourself that you don't know for sure that you're right, then it's a little easier to feel some empathy. So let me pull up that sheet here really quick. I got to get out of the PowerPoint for just a second. Okay, so this is your worksheet. So hopefully you filled out everything that was on this left-hand side. I made up a story, and please, if I botch this and use the wrong wording, I apologize, but I'm just trying to help you see kind of how this works. So if you filled out the left-hand side, I made up this little story, describe the discussion or the event. I'm pretending I'm an outreach specialist, which I would never actually be able to do, so kudos to you. But I go in, and a nurse won't allow me to finish pitching the program to a new mom. So the next question is what I wanted. Well, I wanted to sign up the client, right? How I saw myself. Well, now I'm a victim. The nurse just completely made me powerless, and I didn't get to do what I wanted to do, and I'm not very happy, right? Now, how did I see the others involved? Well, the other in this case was the nurse. Odds are I'm going to be very critical of her now, right? So I would think she's terrible or closed-minded or unreasonable. What were my intentions? Well, my intentions were simply to share program information with that potential client, and this nurse prevented me from doing it. Now, what would my behaviors be after the nurse does this to me? I might glare at her or use very short-worded speech or sigh or shake my head. I'm clearly demonstrating in my behavior that I'm unhappy with her behavior, right? Now, do my intentions in this case match my behaviors? If my intention is to share the program information with the potential client, that's my only intention. How is behaving like this matching that intention? That's something for you to think about with whatever your own conflict was. Like, hopefully you fill this out and you have your own. But now, in my case, in my little made-up story, the answer is no. My behaviors do not match my intentions. Now, even more important, and I know I'm guilty of this. When I first learned this, I thought of all the times I've done this in my mind to people. But what happens is when we're not getting our way, we start to inflate our own virtues. So in this case, yes, I am just doing my job, and I do it very well, and I absolutely know I would have enrolled that mom if that nurse had not interrupted me, because I'm fabulous, right? Then at the same time, if we inflate our own virtues, another way to do that is to inflate the other party's faults, right? So the answer is yes, this nurse isn't very good. If she doesn't want the best for the mom, Welcome Baby would really help this mom, and if the nurse was more interested in the mom than her, quote, procedures, then that mom could have been enrolled. Then the last statement or question is, did I clearly identify and express my needs? And we're going to talk more about needs in just a moment. But frankly, when I'm in my ego here, I'm thinking, yeah, I told her I needed to finish my discussion with the client. I told her what I needed. She didn't give it to me. Now, here's the part we're going to do together. So hopefully you printed it out. If not, then just follow along. But please really try to do this so that you feel the difference. So the discussion or the event is the same. Couldn't finish my discussion with the mom. But now if I think about it out of my ego, what I really wanted was to reach my goals, my enrollment goals. Okay, I mean, it's similar, right? But in fact, if I think about it, that was really my overarching what I wanted, right? Now, if I think about how I see myself outside of my ego, I might realize that maybe I didn't take the whole picture into account. And then how do I see the nurse differently from my heart instead of my head is that the nurse may have had a good reason for not letting me finish. She could have been doing her job really well. Maybe there was something going on with the mom, or she had information that I didn't have. So instead of judging her as being a terrible nurse, I might consider maybe I didn't have all the information. And then if I think about my intentions outside of the ego, just from my heart, but this is the truth, I did want to share program information with the mom, but I also wanted to sign up that client. So what could my behaviors have been? How could they have been different if I'm thinking outside of my ego? Well, instead of getting, glaring or being passive aggressive or something, what I could have done was maybe take a few deep breaths. If the opportunity arose, I could ask the nurse outside the room if I could return when she was done, or I could just thank the nurse for her time and realize that, there's something going on, it's out of my control, and there's no need to get upset or angry or judgmental. Now, my intentions and my behaviors match. I want to share information. I want to sign up the client, and I'm going to be calm, and I'm going to not be judgmental about the nurse, and I'll either figure out another way to talk to that mom, or I'll just go on to the next mom, like whatever the situation calls for. Now, I'm more accurate outside of my ego. So I could be thinking something like, it's the end of the month and I'm short on my enrollment, so I might have felt pressured. I do a great job. I still do a great job, right? But sometimes the stress interferes with my response to situations. And that's true for all of us in any situation. We may have the best of intentions and we may really want to stay out of our egos, but if we're under pressure or under stress, we tend to slip back into it. Now, again, I also see the nurse differently if I'm outside of my ego. She may have faults. I don't know, right? I know very little about her, and I have no idea why she interrupted me. So the key to this is she may have interrupted me, but instead of assuming she has a lot of faults, what I want to assume is that I made up a story. I mean, that's not even an assumption. I did make up a story. I decided she was terrible at her job because I didn't get what I wanted. So you can see that when you fall into this pattern, and it's very common, very, very common pattern, then we don't get what we want, and the other person either doesn't get what they want, or it's an uncomfortable situation, or there's hard feelings, and it's just not very effective. So if you didn't fill it out again, please do so. Think of a real conflict so that you feel the feelings and you get the difference of how things could have what the outcome could have been versus what really happened. So now let's talk about the second key, because we're going to move into needs now. So compassionate communication requires empathy for the other person or group. And yes, I know how hard it is to feel empathy for someone. But in fact, we all have the same needs. And if you start thinking from the perspective of what is this person's unmet need, or what is my unmet need, you'll start to see how it's easier to feel empathy for someone. Now, you cannot reach empathy if you feel disconnected from that other person or group. Hopefully we all know what empathy is, but basically it's feeling with the other person and recognizing that we all have the same needs. You want to establish a connection through listening, that's first, but then you want to move into starting to see what are the needs involved. So actually, in your handouts, there was a list of universal needs. So in the next couple of slides, what we're going to talk about here, I'm sorry, bear with me with technology. We're going to talk about needs and feelings. So I gave you two handouts. One was examples of feelings, and one was universal needs. So I'm going to take a minute now just to start with the needs, but I want you to really look at your list, and if you didn't print it out, you can print it out later. But one of the keys to compassionate communication and to collaboration is to understand across the world, no matter what your culture, no matter what your ethnicity, your religion, anything, we have innate needs. So all of us have all of these different needs. If you have ever studied psychology, you're probably familiar with Abraham Maslow. He had basically a hierarchy of, I think it was 5. But this, Dr. Rosenberg breaks it down into a lot more detail, which is really, I think, useful, because a lot of times we don't think of the word we're thinking of as an innate need. And this kind of really covers all the areas. So we all have a need for security, safety, that includes consistency, dependability. There may be other words that match that, but it's really about being safe and being healthy. We all have autonomy and authenticity needs. We want to feel like we have choice in life. We want to live up to our values. We want to be true to ourselves. We want to feel good about ourselves. We all have a need for clarity and awareness. So that's consciousness and understanding. I won't go through all these, but I just want to make sure you really take some time to look at it, because you'll see in a few minutes how some other words we use actually directly tie into these universal needs. Now, most importantly, we have these needs, but so does everyone else. So when you are in a disagreement with someone, or you are struggling with someone because you want something and they seem to want the opposite, if you can break it down in your mind, even if you can't say it out loud, to what's the unmet need here, then you'll start to see that you have real movement in what's occurring, and it's easier to figure out how you can help both you and the other party, or your group and the other group. So where this becomes a little complicated is we're not really ever taught how to describe our feelings. Most of us are very hesitant to say anything about our feelings because we've been taught that we, quote, should not show our feelings. And keep in mind that feelings come from the heart, not the head. So if you are in an ego-based conversation, I'm right, you're wrong, I'm good, you're bad, you're not going to be able to identify your feelings. So another thing that you can do is go back to your conflict on your worksheet and see if you can describe your feelings. Now, we talked about what you were doing, your behavior, your judgments, but see if you can see how you were feeling. Were you feeling hurt? Were you feeling upset? Were you feeling disrespected? What were your real feelings that were going on during that conflict? And also, after you've done the right side of it, how were you feeling when you think about it? How do you feel now about it, like if you were coming from your heart? So the other handout that you have is your feelings related to your needs. So to give you an example, in nonviolent communication or compassionate communication, and again, hopefully you know how you feel, but a lot of times we really can't identify it. So if your needs are not being met, look at all of the negative feelings that you have or could have, right? All of these, or any of these, or one of these could come up if you have a need that's not being met. But it's the same for the other party, right? So if they're agitated and you're aggravated, neither one of you has what you need, you're not going to have a successful outcome. Now, when your needs are met, then of course we move into the more positive emotions and feelings. So what you want to always be aiming for is to figure out what's the unmet need and how are you and the other party feeling about that unmet need, because that will help you feel empathy. If you can identify that the other person is feeling apprehensive or ashamed, and you can have empathy for that feeling, even if you don't feel like you love that person at that moment, but you can empathize with that feeling, that's going to help open up that flow of conversation. So we have different feelings when our needs are being met and when they are not being met. And I know this language is very different, but I'm telling you it makes a huge difference. So picture actually even having an argument with someone, and instead of thinking in your head, what an idiot or whatever you're thinking, you could think, what is their unmet need that they're behaving this way? You suddenly can feel empathy. It's amazing. It's like a magic thought. Okay, so now the fourth key again is identifying your needs. And we are not taught how to do that either. So think about, what do you need? When you look at your conflict, what did you really need? When you look at, so if the need was to, let's go to the, when we were in our heart instead of our head, and realize maybe the pressure of meeting our goals by month end was affecting the way we were behaving. Well, what did you really need in that situation? And if you go back to the universal needs, you'll see there are, it could be that purpose and effectiveness. Maybe you had a need, an unmet need about feeling competent, right? Or maybe it was affecting your need for respect. Maybe you felt that the nurse wasn't respecting you. So you see there was an underlying need that wasn't being met, and that's what was helping to create your frustration or anger or whatever was happening. So conflicts occur. And remember, conflicts are just disagreements where everybody's not on the same page because there are unmet needs. But frequently, we don't even know what that unmet need is. So you want to get in touch with your feelings and your needs, and that helps you to stay out of the ego. So empathy is the fastest way to get out of ego. It always is. It's just, to me, it's hard. If you're in your head, it's hard to get out of your head, right? So again, use the visual of something that helps pull you out of your head. And then when you shift your focus to the other person, genuinely connect with them because you're going to listen, you're going to aim for empathy, then you're no longer self-focused and it frees you from your ego. Now, this does not mean that your needs will not be met. That's always everyone's fear. The most common response I get is, well, no, then they're just going to take advantage of me, or no, they're just going to walk all over me. That's not the case. If you really practice this and you start to realize that you have needs that need to be met and so do they, suddenly all of the details don't matter anymore. You're focused on what's the unmet need. It's the starting point for genuinely resolving or avoiding conflict because you're seeing things clearly. So once you connect, you can reach a place of understanding each other's needs. And then from there, it's really not that difficult to, really find a way to for both parties to have their needs met. Now, Dr. Rosenberg actually used this whole process with very, very contentious groups, like in sessions between Palestinians and Israelis, where they started out like screaming at each other that the other party were murderers. I mean, it's very intense. Or with during negotiations between unions and companies. So where things are really hot and there's a lot of people involved, and was very effective. So I think we could probably handle it with what we are dealing with in our daily lives, because it's proven to be very effective with much more severe situations. So practices that support compassionate communication and collaboration include expressing our own needs, sensing the needs of others regardless of how others are expressing themselves. And I will say, I've even practiced this. Have you ever been in public and you see someone behaving in a way that kind of makes you cringe, like they're yelling at someone they're with, or they're being very rude to a sales clerk or something? I've now gotten in the habit of, my first question now in my head is, wow, what is their unmet need? Because it's not about the sales clerk, or it's not about probably whoever they're walking with. It's about the fact that they have something that's a need that's not being met. And as soon as I do that, I can even feel compassion or some empathy, at least, for somebody who I used to judge as behaving badly. So it really is effective. Then you want to check in to see whether needs are accurately being received. Okay, it's a two-way street here, right? So providing the empathy people need in order to hear the needs of others, and translating proposed solutions or strategies into positive action language. So this is what we're going to talk about next. So you want to check in to see if you have received their needs correctly and if they've received yours, right? And then, of course, you've got to get empathetic, and then you've got to find a way that you can actually talk about it. So this is the heart of nonviolent communication or compassionate communication, which is expressing honestly through 4 components that we're going to talk about in just a second, and receiving empathetically through the 4 components. So the 4 components are observation. So that's the concrete actions we observe that affect our well-being. It's not judgments. It's not making up stories. It's just looking, seeing what we see. And then we want to note how we feel in relation to what we've seen, what we've observed. And then, of course, the needs. So the needs, values, desires, etc., that create our feelings. We want to be able to work through that. And then we want to actually make a request, or we want to hear a request from someone else in order to enrich our lives. So you want to think about, when you, quote, need something, it's not about being needy, or it's not about something being good or bad. It's about, is this enriching my life or is it not enriching my life? So again, this is new language that just helps us get a little space in between our feelings and our needs so that we can be less emotionally charged and really get to the heart of the matter. So observing. So it's basically you're observing what others are saying or doing that is either enriching or not enriching our lives. You want to try to be non-judgmental, which is to simply say how you feel when you observe the event. And you've got to think about it. Okay, that hurt my feelings, or I feel hurt, actually is a better way to say that, or I'm feeling scared, or I'm feeling joyful, or whatever it is. It's non-judgmental, it's not good or bad, it's just the reality of how you're feeling. And then you want to understand that identifying how we feel leads to understanding what needs we have that are connected to those feelings we've identified. Another area where many of us, probably on a daily basis, we don't always take responsibility for our own feelings. So a reminder, I know we've talked about this before, but what others do is not the cause of how we feel. It may be the stimulus, or the word everyone hates, it's a trigger, but it's not someone else's fault how you feel. Okay, so we want to accept it, and there's nothing wrong with how you feel, but it's not someone else's fault is what I'm getting at. So we want to be able to say, okay, I am really in a horrible mood right now, and I'm angry, and it may have been triggered by somebody else's behavior, but we want to remember we're still responsible for how we feel. So our feelings result from how we choose to receive what others say or do, as well as our needs in that moment, right? So we have some choice about how to hear what we're hearing, but we also have to remember that if we have an unmet need, that may be overriding what we're hearing. Now, when we hear a negative message, and I'm saying negative as in it's not what you want to hear, so not good or bad, but it's not what you want to hear. We have 4 options. So we can blame ourselves, we can blame other people, or we can sense our own feelings and needs, and we can sense others' feelings and needs. And of course, those bottom 2 are going to be much more effective in both communicating and collaborating. Now, you want to connect your feeling with your need, right? So I feel what because I need what. So, for instance, let's say back to my pretend outreach specialist role, I feel disrespected because I need respect, right? Or I feel disconnected because I need to be heard, right? So whatever it is, and again, only you can really get in touch with your own feelings, but you want to connect the 2. You feel a certain way because you need something, and usually you're feeling all this because your need isn't being met. Now you want to distinguish between giving from the heart and being motivated by guilt. A lot of times we do things out of guilt, and that again goes to there's an unmet need there if you're operating through guilt instead of distinguishing that you're giving or receiving through your heart. Now, judgments of others are expressions of our own needs. So I'm sure you've heard people say things like, you never understand me. That's really a person having a need to be understood, which is not being met. But of course, the problem is when anytime you use the words you never or you always, what are we doing? We're expressing needs in a way that they're going to cause the other person to feel criticized, and they're going to respond with self-defense. And it's a vicious cycle, because if they're in a defensive mode, they're not going to hear you. They're not going to hear what you're saying. They're going to hear it even less. So to effectively communicate, we want to use positive action language. When we express our feelings, we want to remember it may not be clear to the listener what we want them to do. And I know I used to be very guilty of this myself, because requests can come off sounding like demands when you're in this state, right? So if they're unaccompanied by the way you feel or what you need, then they can be misinterpreted. So here's one of my, let me finish this first. Certain ways of communicating alienate us from our natural state of compassion. So when we're making moralistic judgments, she's lazy, he's prejudiced, that's inappropriate, the nurse is bad, whatever it is that you're saying, then you are actually alienating yourself from an ability to feel compassion. When you classify and judge people, it promotes violence. When you compare, it's actually a form of judgment. You're saying somebody's better than or worse than when you're comparing, right? So then it's really judging. And then again, denial of responsibility blocks communication. So if you hear yourself saying, you make me feel bad, then you're not taking responsibility for how you're feeling. Or if you hear the words have to or should, you should know better, or I should know better, or whatever it is, that's a judgment, and it's also where you're not taking responsibility for your own feelings. Also, please remember, always, 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 you can never make other people do anything, ever. Not your children, not anyone, much less coworkers or clients or anyone else. You can't make them. People have to decide that they want to do something in order to do it. So now we're down to how you request this information. So let's, when we make a request, we first need to realize that we can't make an effective request of someone else until we've identified how we feel and we've established what our needs are and what their needs are. And this is true for your clients, with your peers, with your coworkers, with your team. It's like, take a little pause and think about what are the unmet needs for everyone involved, okay? And then you want to be very specific and not vague. So this is what I was about to say earlier. I have heard this exact exchange about 1 million times in my life. I need you to listen to me when I speak. I do. No, you don't. Yes, I do. No, you don't. Yes, I do. It can go on forever, right? There's no specifics, and it doesn't resolve anything. It doesn't give either party what it is that they need or want. So a better way to ask the question would be to ask, would you be willing? So for instance, in this case, would you be willing to consider, that's another one, you can even soften it more, but let's say, would you be willing to listen to me for the next 5 minutes where you're totally focused on what I'm saying and without interrupting me? That's very specific, right? And if you say that in a polite way where you're coming from your heart, not from a judgmental space, the odds are the other person will say, okay. They may even be a little confused at first, okay, but they get it that you're asking for something that you need. You need to be heard for 5 minutes. So when you're very specific about it, then the other party has the opportunity to now engage with you in a different way. Remember to try never to make demands. No have-tos, no shoulds, no do this right now. That is not effective at all, and it kills collaboration. If you don't make demands and you start asking in a positive action language, would you be willing to consider, or would you be willing to do this? Then you can move into specific concrete requests. Now, an important factor in all of this is boundaries. When you are thinking of your boundaries, you have to include your needs. Do you have a need of approval, for example, or of being needed, or of feeling important? And I'm using regular language now because this is what I was getting at earlier. If you have what you're identifying as a need of approval, that could very well fall under many of those categories on the universal needs list. Maybe it's a need for respect. Maybe it's a need for feeling competent, for example, right? Or if you have a need of being needed, again, it could fall into security, it could fall into connection, it could fall into a lot of those universal needs. So if it's easier for you to think in normal language, which it is for me, then you can take whatever you think you have a need for and look at that universal list. And then you can, and the reason for doing that is because then that helps you identify what you have in common with the person that you're dealing with, because they've got those same universal needs. Many of us have a need to be right. I used to really have a need to be right. I don't have it so much anymore. But that's another one that creates conflict. It creates competition, or it creates a difference of opinions. You may have a need of winning. If you're a competitive person by nature, then you have a need to win. Now, these feelings influence then how you establish your boundaries. So I want you to think about that as you're deciding, how you're going to do your work and what's acceptable, quote, acceptable and not acceptable. Those are your boundaries, right? And so if you're including these needs, are you isolating yourself or moving yourself or distancing yourself from really connecting with other people? So you want to step back and look at it, and then you also want to look at your boundaries compared to programmatic needs. Are there any conflicts in there? Because we all have conflicts between what we personally want and what we do for our work, right? So it's not just about your roles. This is true for everyone. But you want to really look at it. Most of us don't take time to look at it. We just get frustrated when we feel like our boundaries aren't being honored. So I'm going to use some examples. And again, I made these up. They may or may not apply, but you can hopefully get from these some ideas of your own about real life situations that you can use this. So let's say you have a need to be needed. Okay, and this leads you to get too involved with the family, beyond the scope of your role perhaps, because it fulfills that need to feel needed. You go in to talk to a mom, and she latches on and tells you, how great she feels because you've come in, which of course is all wonderful. But if you have a need to be needed that hasn't been met, then you may in turn latch onto this situation, right? Because it's going to fulfill a need you have. So now you can't meet your programmatic goals because there's not enough time to see the number of potential moms you need to approach, or maybe you don't have time to make follow-up calls, or I don't know, some of you I think send out letters or postcards or whatever it is that you do, because you spent too much time with one family. Maybe you're at an event and you just get that, oh my gosh, they need me and this makes me feel good. And again, nothing wrong with feeling good about this, but is it within the programmatic boundaries and within your boundaries? And is it a matter of your personal needs getting met, but now your professional needs aren't? So you're creating your own conflict because now you've got a problem, right? So it's not about anything being wrong with having a need to be needed. It's a matter of understanding that you have an unmet need, and then you can identify other ways to meet that need. So if you want to feel or need to feel needed, then maybe you need to step back and look at your personal situation. Do you have the support you need? Do you have the friends you need? Do you have the relationships you need? Do you have whatever it is so that you can fulfill that need through other outlets? Then when you have a mom that is so grateful for whatever, that you're telling them about the program or for you or your personality or whatever it is, you can enjoy that, but it doesn't create a conflict between your programmatic needs and your personal needs. So came up with another example, which is, let's say 2 outreach specialists are invited to an event for pregnant women, whatever that would be, maybe a baby shower. And if one or both have a need to win, then circumstances are ripe for a conflict, right? So our programmatic goals are to promote Welcome Baby, obviously from a client-centered approach. But if 2 outreach specialists become embroiled in a disagreement about who's going to take the mom home, then maybe the programmatic needs become secondary to the need to win. So that's why it's so critical to understand your own needs and to have empathy for others' needs. Then a compromise can be reached that helps both parties. Obviously the whole goal here is to try to have our needs met. So there's no conflict with programmatic needs. So, it's always like a bundle within a bundle within a bundle, right? So we've all got our own universal needs, like everybody has the same, but on top of that, now those needs, we need to just to really review them in the context of the programmatic needs to make sure we're not trying to fulfill needs that maybe could be met somewhere else. And then finally, the third one is an outreach specialist is told by a hospital marketing representative, I don't know if this ever happens, but that they will not be allowed to use certain Welcome Baby materials to distribute at the baby shower. And the outreach specialist is informed that the hospital has created their own materials that include Welcome Baby information. So now I want to ask, how would you handle this? What would you do? So you can talk or you can type it in the chat box, but what would you do with this? Like, you can give me an example of just maybe if you're in your head, what would you do with this? Or if you were trying to really collaborate with this hospital marketing person, what would a different approach look like for you? Anybody have any thoughts about that? Has this ever happened to anyone where there's a difference of opinion about what you hand out? Yes. So Marty, I created materials with no logo. Okay. Work with the hospital marketing team. Yeah, I agree. Any hospitals? Okay. So I'm assuming everyone can see in the chat, so I'll let you keep reading the responses over here. But yeah, the idea here is when you're we need collaboration. Remember at the very beginning of this presentation, we talked about all of the different relationships you have to juggle and your sort of conflicting loyalties even. Do you do what's going to make the hospital happiest because you got to be there, you got to go there every day, or you want to be invited to things? Is it what your supervisor's asking you to do? Is it what your personal goals? So if you can find a compassionate way to communicate and discuss and work through these events and issues, then it would be to your benefit because you'd be meeting your needs, and it would be to their benefit. So like in this case, the hospital marketing representative is just doing their job, right? You're trying to do your job, they're trying to do their job, and the two are not aligning. So instead of getting upset or mad at the person or frustrated or angry with yourself or whatever it is, it's like, just think, what is the need you're trying to meet? Maybe you don't have an emotional need in this case. You're just trying to follow the rules of the program, and their rules are conflicting. Well, if you don't get, you don't take it personally, you don't get in that emotional sort of flux, then it's pretty easy to kind of work out. So I see there's all kinds of responses popping up in the chat. Okay, let me see here what we've got here. So hopefully you can all read that. It's so quiet. I'm hoping you can all see the chat box and you can read these. But it sounds like most of you are responding in a compassionate way, in a positive action language or good alternatives instead of getting upset. Flexibility, that's very important. Thank you for that comment. And respect, very good. So that is the ideal. But the reason I wanted you to do that conflict worksheet is because when we don't do the ideal is when we're upset. So give that some thought as you're going through this, to think about what happens when you can't work it out. What do you do? Right. Very good, Anna. Yeah, adapting to the situation. Adaptability is key to everything, to all success. I'm convinced now if we can just learn to be adaptable, we can get through everything. But I want you to share now, like, what's your biggest challenge right now? You can type that in the chat box if you don't want to say it over the microphone. But what are you, as an outreach specialist, what's just one? What's your biggest challenge right now in being effective as an outreach specialist?
Hi, Teresa. This is Anna. Do you hear me?
Hi, Anna.
Hi. I want to speak to a very general, I think it's sort of like a universal theme, and that is keeping our partners, our clinics, our the various organizations that we work with to refer clients to the program.
Wait, Anna, can you stop for 1 second? There's a background noise. Thank you, whoever just. Thank you. Okay, say it again now. So
yeah, I was
so
just
in your partners.
Yeah, one universal concern I think that we all engage at some point or another is partners that come in and out of this motivation to refer to our program. You know, for some time we may engage a provider that's really excited with working with us, and they're kind of matching our excitement, and then all of a sudden you lose that. You know, it's sort of like a theme that we have experienced throughout the years in the program. And it could be that they are facing their own challenges and their own needs are not being met. But here we are, just as excited as always, but there's a mismatch, right?
Yes.
It's just kind of adapting to that and understanding that the provider or the partner that we're working with is having needs that are not being met on their end, given their administration, the culture of the environment that they work in, and really thinking about how they're not meeting their needs. So it's going to be difficult for them to work with us and help us meet our needs.
Right.
So I just wanted to speak to that because we kind of go through that a lot here, and I'm sure our other sister sites go through those challenges.
Oh, thank you. I think that's a great example because, so obviously you know what your needs are, right, for the program, but then when that happens, because I shouldn't assume. For me, when I'm excited and someone else is excited, that motivates me, right? Then I'm more motivated. I can't wait. I get excited. But if they're like, oh, whatever, then my motivation starts to fall, right? So now I have an unmet need, but the unmet need may not be motivation. It may be self-esteem, or it may be the competence need, or I could start doubting maybe that the problem is me. And so I love what you just said, because you look at your own needs and you want to identify them correctly, but then you also, exactly what you said, you want to think about what are their needs. And it may not even be organizational. It could be personal. We're all humans. So maybe they're tired of all these programs coming in and interrupting them every day where they're trying to get a job done, or, you know what I mean? And then their really unmet need is security because they're worried about their job performance. Or you really don't know without having that conversation with the person. So I love that that you're willing to just sort of keep rolling forward and think, okay, well, there's probably something going on, and it ebbs and flows. But at the same time, you might want to think about it the next time it happens, like, oh, is there an unmet need for this other person? And maybe it's something we could work together on, and then you can discuss it without making them feel guilty. See, that's where this whole compassionate communication comes in. It's not about going in and saying, well, why aren't you supporting us anymore, right? Because that makes them defensive. So it'd be more, okay, I've noticed that you don't seem as enthusiastic, and I'm wondering, is there, something I could do to help? Or, I don't know what all the language is, because you're the experts in this role, but that's exactly the idea. Is instead of assuming either that there's something wrong with them, what's wrong with them, they're too lazy now, judging, or instead of assuming that there must be something wrong with you, you just sit back and look at what are the unmet needs. Your unmet need is, you know, on the surface, it looks like it's because of, you know, the unmet need is getting access to moms, but really there may be another unmet need underneath, which is emotional. Am I going to look incompetent? Am I going to fail at what I'm doing? Am I going to be excluded from, you know, looking successful or whatever it is? So you just want to just take that extra minute to think about that, because that will inform you as to how you can respond in a positive way that will meet your needs and their needs. So thank you. That was very good. Use of motivational interview helps with these scenarios. Yes, it does. I agree, Anna. I agree. Good. What else? Anybody else have one? Any challenges that are coming up for you right now with around this, with communicating or collaborating with others? We are going to have an open forum in just a moment. So if you have other issues, we're going to have time to talk about it. But I just want to smile and breathe. Yes, it's always good advice, and we forget to do it when we're in the middle of a heated exchange. So this one says, I can relate to the idea that if it's me, I am not good enough because my lobby enrollments have dropped compared to previous months. Yeah. So, and again, I'm not saying factually that may not be true, but you want to think about, okay, then what's my unmet need right now? It's not just the dropping in the numbers, it's how am I feeling about myself, because that's going to affect how you then collaborate or communicate with other people. So you want to really just get in touch with that and figure out, how do I make that better, and then what steps can I take that would help me meet that need. So if it's a need of self-worth or self-esteem or whatever the emotional or the feeling or the need is that's not being met. So good, thank you. You can put them in there. I'm going to go on just to ask if there. Wait, first, before I ask questions, then we'll come back to this. There are resources here, and I'm going to make this presentation available to any of you that want it, or Steve will send it out to all of you. But I wanted to point out a couple of things. So one is, we talked about motivation, and I think, again, I think your role really requires a lot of self-motivation. So Daniel Pink wrote a book called Drive, and it's about what motivates us. So if that's an area that you want to do some work in, that's an excellent resource for that. Of course, Dr. Rosenberg's Nonviolent Communication book, and there's workbooks, and there's videos, there's a website, so you can find out anything you want just by putting nonviolent communication in your browser. Daniel Goleman's work, I mean, he's written many books, but Working with Emotional Intelligence is a good one, because it really kind of helps, gives you steps to increase your emotional intelligence, which again is self-awareness. And then one that I loved, if you think you get defensive too quickly, which many of us do, or if you think someone else gets defensive too quickly, this YouTube is really good. It's called Cultivating Collaboration, Don't Be So Defensive by Jim Tam. And it's an excellent short, I think it was 18 minutes or at the most. So I've included the link for that, so if that helps anyone, take a few minutes to look at it and just see what you come up with. So before we move to the open forum, I want to just ask again if anyone has any questions about compassionate communication or anything we just talked about in the presentation, or if there's any other resources you need. Of course, you can always email me, but does anyone have any questions? Okay, that noise is worse than crickets. I don't know what it is. Okay, then I think what we'll do is, again, and you can bring up questions through the rest of this time we have together, but let's have some time with open forum. If there's anything else on your mind or anything you want to share, questions in general you want to ask.
When you're thinking about questions, are you referring to questions because the presentation? General.
Just in general, but someone fixed this problem a minute ago, so they must have known it was them, but there's that back thing. Thank you. Okay, so no, this is open forum. You can talk about whatever you want.
And just to avoid the feedback, if you're not talking, just please mute your phone. I think that'll help. But everyone is unmuted right now, so yeah, if anybody has any comments on that. I thought that was interesting to look at it in terms of needs. I don't know if anybody has ever really thought about their work in relation to the needs of a clinic, you know? And if so, I would be interested to hear how you think about the needs of a clinic as it relates to your work, trying to do enrollments and trying to get the clinic on your side to promote Welcome Baby.
Hello, this is Tina. I think that it's back of my mind about I've been doing this for quite a while. You know,
Can everyone please mute your phone if you're not speaking? Thank you. Go ahead. I'm sorry.
Yes, I mean, I am very welcoming everywhere, every clinic that I go. But my question is, like, if they're so welcoming and they're so open to the program, what is it that they don't do the extra little step that it needs for them to send the referrals instead of me going looking for? I don't know if you understand me. I mean, yes, I always could say, I mean, kind and pleasant and genuine. That's the word. And when it comes to that, what is it that I can do for them to do the extra step that requires for them to send referrals?
Right, right. So I would open that up to everyone. Do you have any suggestions for her? I mean, I would obviously suggest a conversation, but does anyone else have any feedback about that? What else could she do to get this person to take the initiative to refer people to the program? What would you do?
Hi, Tina.
Yes?
Whoever asked the clinic,
I can hear you. That there's a.
But have you ever asked them, like, you know, since we're talking about what your needs are, have you ever asked the staff at the clinic, what is it that you can do to help them send those referrals automatically?
Yes, yes. I mean, let's say, for example, there's a clinic that's always packed, and I know she's always very busy, and then I just, when I walk in there and said, let me know if you have a minute or two so we can chat and we can talk. Oh, sure, come over. And we talked, and I said, what is it that I can do for us to work together, or, you know, hopefully it's not from me. Yeah. And I mean, let's say, for example, her, oh yeah, you know, I tell them, but they don't want it. I don't know, maybe I don't know how to talk. I said, well, tell me that I can, we can go over. What is it that I can show you, I share with you?
I know I end now because noise.
Or she will just say, like, you know, I have a lot of paperwork. I do have a lot of work. I tell them, but then they're not really convinced. So I don't from them. I think we're having a hard time with this.
I know there's background noise. So it could, you know, I would say that if you've had the discussion, and especially if they've indicated to you that part of the challenge is how busy they are, then you're recognizing they have a need, but what is the underlying need? Like, so maybe it's conflicting priorities, maybe it's you know, they're trying to meet the requirements of their job, and they don't, you know, they want to be successful and they don't want to be seen as incompetent, you know, whatever it is. Then maybe your only option then is to do everything possible on your end to make it as easy as possible on that person to refer people. And I don't know what that looks like or if that's even useful, but sometimes you can't. I mean, that's the whole point. Even if you can't get them to do what you're wanting them to do, you can still be compassionate about it, which is going to cause a response from them to you that is also more compassionate. So maybe it just takes time.
Yes, and I understand they have a lot of work, a lot of paperwork, and that's one of the things that, like you said, they wanted to be on top of things. They want to take care of what is requirement from them, from their job priorities, and then they kind of like, okay, this is extra. And my thing is that what can I do for them to change their mind, their way of thinking, or their mind about like, oh, this is extra work, because it is extra work, and I know that.
Yeah, so you can't really change their mind about that, right? You can't change anyone's mind if it's real, but you can be consistent. Go ahead. Who had something?
I'm sorry, it's Fallon. I think, yeah, I definitely agree that you cannot change somebody's mind. As far as it being convenient, I would say, I'm pretty sure you've done it, but maybe ask them if okay, just a couple of things. I was thinking once the client or patient signs the paperwork when they first get in, that maybe the outreach form could be a part of their paperwork, one. And two, they don't have to send anything, then maybe you could come to the office and just pick them up.
Yes, I mean, yeah, some of that is working perfectly fine with one of our education department here at the hospital. Is working out perfect because she gives the form as part of the paperwork that they need to fill it up. But I'm talking more about it like with doctors, like in the community.
Oh, you know, the other thing is like, is possibly also showing how we can collaborate with the doctors to make their life easier, meaning that once the client is enrolled in the program, the way it's set up is that, you know, once they deliver their babies, then there's like a 3 to 7 day visit where the parent coach or the nurse can remind the mom, hey, you know what, it's the baby's well visit coming up, or, you know, has your baby had her their well visit, their well child visit, or when it's like around the 2-month visit, like, oh, have you guys had your 6 months? Or when it's a 2 to 4 week, you know, your 6 month is coming up. I mean, your 6 week checkup is coming up. You know, so I guess the benefit to promote it as far as like, we're here to assist you guys in the things that you're already, you know, and like some of your goals. So maybe if they have like low retention rate for the mom to come back for postnatal visits, a 6 week checkup. So I don't know why I can't talk right. Then maybe you know, we can say that with our program we've had this much success, you know, and it would be it would be good to see how we can work together to maybe increase your numbers when the mom's enrolled in Welcome Baby. I don't know. I'm not saying make nothing up, but you know,
that's a good suggestion.
Yeah, that's great.
Like how we can work together for your numbers to come better on so and so and so, whatever it is that they are following through. Yes, that will be a good option. Like to put it on them, like this is going to be working for you versus working for me or for for the
not necessarily that it's something to benefit them as well.
Right. They have to see that. They have to see that their clients are going to come in and that they're, you know, going to return. And the other thing is too is like I let them know like we're not taking your clients from you. We're really are literally here to just like assist you. And you know, like I say, where you stop, that's where we begin, you know, so like you guys can't go to the homes, but, you know, if you have a mom that's really struggling, then that's when we get to come in and assist that mom and help that mom out so that it makes it a little bit easier for you. Those are just some things that I have to say.
Excellent. And Christina's added into
that. Yeah, what I really like what everyone is saying. And one of the things that I think it's a good idea to do is periodically deliver that letter to providers letter that really outlines the benefits with working with Welcome Baby. We have that letter that we can mail out to the doctor, to the CPSP coordinator or caseworker, and just kind of continuously remind them why this is a really good idea to collaborate. Just to kind of reiterate what Ellen was already saying. So there is that letter that can support that.
Great. Christina added also, thank you by the way, but Christina also added over on the side to maybe provide some testimonials and also asked about lobby intakes, if that's possible. So more good ideas.
I do lobby intakes. I mean, mostly all my clinics that I visit, like I said, they're very welcome, and I do a lot of lobby intakes. My thing is for them to send it directly instead of me going and do the one-on-one outreach. I mean, one-on-one outreach for me, it works excellent. Actually, that's where I make all my numbers, all my prenatals. That's how we do prenatal, not prenatals. I mean, to me, it's the same thing because we provide the services, and it's great. I mean, I don't have a problem with that. My one-on-one, it works excellent on all the lobbies, and I'm very welcome on all, and relationships are great. But what I mean is for them to do the extra step and them to send them in.
Yeah,
that's my thing.
That's going to be, unfortunately, that's just the nature of our job. Like, it kind of sucks because, like we said, if their mind is made up, then it's just made up, and they're, it's kind of hard, but yeah.
Right, but I do want to say it's worth it to just take a few moments to really try to sort of analyze the situation, though, because maybe their mind's not made up, or maybe it is a matter of they have a need that you could help them meet that would then help meet your needs. So in some cases, you're right. If the person just isn't going to do it or doesn't want to do it, there's not much you can do about that. But I would encourage you not to jump to that assumption with everybody. Like, really try to take a look at, wow, is there all the positive things you guys all just said about what could you do to make it where you're assisting them or where they feel like they're supported. That might shift it, might not. I mean, you can't make them change, but it might.
Some people don't have the capacity either. So I know some clinics, they don't have the capacity to actually like email, or they don't have like the fax to send them. And so,
Right.
That is
Great.
so
Anybody else have anything?
I'm
sorry.
I have one other suggestion for Steve Nash.
For Steve?
For the group, is there any way of because I've seen it here at the hospital with the L&D, they have a form, like not a form, it's almost like a magnet. It's a piece of paper it's a magnet that they put on the refrigerator, and it basically says the number, like the person of the doctor, the blood type of the child, emergency contact, things like that. And I was thinking, what about if we came up with something like that for the Welcome Baby program that basically like lists the dates, like it has the appointment that the mom would get if she was school scoped, and then as the parent coach goes to the home, she can write the date of their next appointment, and at the bottom could have like their phone number and their contact, because that's always something that we get a lot, is that we get phone calls from clients and they forget who the PC's name or their phone number, who they spoke to, or when their next appointment is. So maybe having something that the mom can either put on the refrigerator as a reminder of when their next visit is, and the name of the PC and their phone number, so that they are always aware of who that person is.
That's a great idea.
Is that anything that we can create? I mean, I have
I think that's
has, and I can send it over just to get an idea. But I mean, specifically just for just for Welcome Baby.
Yeah, I think that sounds great. This is Myra, right?
Yeah.
Hi, Myra. Yeah, I think that's a terrific idea. And you say you have an example that you can send us?
Yeah, I have something that we have that the L&D nurses use, and it basically says like the baby's name, their date of birth, their blood type, if they have any allergies or emergency contact, the baby's doctor, the telephone the telephone of that doctor, and the mommy's doctor and that mommy's telephone. And so I was thinking this would be great, but if we did it just as a mock with the appointments, if the mom was full scope, and we can even do it for welcoming life with the date. Just on the top, it'll say like first visit, hospital visit, first visit, the 2 to 4 weeks, 2 months, the 3 to 4 months, and the 9 months, right? And then on the left hand side, it can just be blank. And as the PC goes to the house, or the RN or whoever goes can put the next appointment on there. And at the bottom, it can have the PC's name and their phone number, so that the mom can have it like on the refrigerator, like a magnet, and that
great idea.
So as if they ever call, we say, "Oh, who's your PC?" And they're like, "Oh, I don't know." "Oh, do you remember we gave you that magnet? Can you check that magnet really quick and just let me know who your PC is, so I know who to direct the phone call to?"
Right. Yeah, if you have a sample that you could share with me, I'd love to see that. I think it'd be great to see if we could produce something like that.
Okay, perfect. I'll send that over. I'll scan that over.
Great, thanks.
So Steve, I guess I'll turn this back over to you. I don't know if you have anything you need to do to discuss with the group, but.
Sure, thanks, Teresa. Yeah, and I want to thank you, Teresa, for a terrific presentation. I think this is a great topic for anybody, but especially for work in the world communicating and doing outreach. This is especially important. It's great presentation, so thank you.
Thank you.
If anyone has other issues they want to talk about as far as the presentation goes, you can continue to, do some chatting, but if we want to just, I think we only have like 5 minutes left. I want to be respectful of everyone's time. And I thought in the open forum, we might want to go over some goals that you might have. I don't know that we really have time for that now in 5 minutes, but something to think about as it relates to needs. But I also wanted to talk about, as it relates to needs, what you think would be beneficial for future webinars, future calls, other topics that you feel like you need support, or maybe don't need support, but just have a desire to get support on. If there's anything anyone wants to shout out now, feel free to do that. But if you want to think about it and email me as we come up with future topics for these calls and webinars, I'd appreciate it. I'd love to hear. Obviously we want to do what works and helps you.
Steve, thank you, Terry, for a wonderful webinar. I really enjoy it. We need a lot of this because a lot of the outreach has to do with how we speak, psychological, and how we are prepared to others. On the picture, I would like to have some kind of webinar or over. Do you hear me?
Now you're back.
There's a fair amount of background noise there.
Yes, I don't know who belongs, but I hope you hear what I said.
That's better now. I actually didn't catch that last part. Could you just repeat that?
I said that I would like to have a webinar or a meeting or whatever is available as on how to stay focused.
Oh, okay.
Staying focused. Okay, great. Thank you.
This is Anna, by the way. I think that right along the topic of focus, staying focused, maybe something around staying motivated, finding that spark again if we're losing it. Because it is challenging. I hear the concerns when our partners are not as motivated or as ready to refer, and we do all this work to kind of establish those partnerships, and sometimes they really don't go anywhere. So you kind of feel a little stuck there. So maybe
Sure.
just a forum where we can speak more about the challenges and kind of get empathy from within the group, and maybe explore like what we had just started, kind of like sharing ideas within about what could work. So maybe a little more time about to do something like that. And another topic that I thought would be really great is maybe a review of what the CPSP program is about.
Oh,
As
that's,
you know,
yeah.
I have been attending, so I have attended a couple of those meetings to kind of speak to CPSP providers in LA County, and just maybe bringing someone from LA County Public Health to talk about CPSP and how their mission and their goals are very well aligned with what our goals are for our moms and welcome baby.
I think that's an excellent idea. Yeah, and even just the act of bringing someone in like that, I think helps to get buy-in from them. So I think that's, and obviously great to learn about from our perspective as well. But I think those are great ideas. Thanks, Anna.
Tina.
Anybody else? Other thoughts on future topics, other things to explore? All right. Yeah, we really have just about a minute left. So how about we just go through some quick updates. If anybody has other announcements, other things they want to announce to the group, feel free. All right. Well, I know we have a couple small updates on our end. I just want to remind everybody that the form for quantities and materials in the next bulk print run is out there, and we've sent an email to program managers. Hopefully all of you have been informed that that's out there, and we've got a few of those submitted, but we want to make sure that the deadline really that we set was this Friday. So if everyone could please submit those forms to let us know what quantities you want marketing and outreach materials for the next bulk print run, that would be great. And if you haven't heard about that, please ask your program manager. They should all know. Jessica, I think Jessica has one on material.
Everybody. So we did get an order of pens, and I was able to separate them. So we're having a training for some of the other staff, and whoever's here from that training will be taking the pens back to your sites. So you should probably get them by Friday, because I know there's another training tomorrow. But just so everyone is aware, I know pens are a hot item, but just if everyone could also be aware that for us, we give out a predetermined amount each fiscal year. Sometimes we have a little bit more leeway with funding, but our budget's really tight. So for now, this is what everybody will get for the fiscal year. So it's about 350 pens. If we are able to purchase more later on throughout the fiscal year, we'll definitely do that. But as far as I'm aware, you are able to use some of your site's printing budget. Just make sure to check with your program officer first to make sure that they approve it. But if you guys have any other questions, feel free to let me know.
Great, thanks, Jessica. I don't think First Five is on the call, so if anybody from First Five is on the call, do you have any announcements? Okay. Data team, any announcements?
Actually, we do have one quick announcement. We are going to be reopening up the search feature for OSs to search for all cases within your agency after your feedback and discussion with First 5 LA. Not quite sure on the timeline just yet, maybe a month or a month and a half, but we'll definitely keep you posted.
Great. Thanks, Teresa.
Hey, Steve. This is Jan. I have an announcement for the group, and I just want to say congratulations to Steve. He has accepted our position as the Senior Communications Specialist, and that's why he's leading this call. And then I also want to acknowledge that Amanda has extended her personal leave, and she will not be returning to LA Best Babies Network. So we thank her for her 5 years of service, and we know that she's formed some really strong relationships with many of you, and we all wish her well. So, and we're very happy that Steve is staying with us.
Thanks very much, Jan. Thank you. Happy to be here. Happy to be with you all. All right. Well, with that, we are over 3 o'clock. So unless there's anything else, we can adjourn. And thanks again to everybody for joining us.
See you soon.
Good to get everyone together again. Thanks again, Teresa. Appreciate the presentation.
Yes.
Thanks for all the great comments.
Thank you.
All right. Well, until next time, you all have my email address. Please feel free to send any follow-up questions or comments my way, any ideas. And with that, we'll leave it there. Thank you again. Have a great afternoon.
Bye.
Bye-bye.